knowledge series as part of World Patient Safety Day celebrations. We as a healthcare professionals, we know that we have a big role in ensuring medication safety. And World Patient Safety Day is instituted in the year 2019, and this year the theme being medication safety, with a special logo, with a special slogan of medication without harm. And WHO calls for a global challenge for all the key stakeholders to ensure to increase the public awareness about safety issues pertaining to medication use and need for safer medication practices. This year, the main 4 domains of the strategic framework for the global patient safety challenge is patient and the public, healthcare professionals, medicine and systems, and practices of medication. You can see the picture here. And this knowledge series is actually is a capacity building exercise for the healthcare professionals in terms of education and training. We are very happy to host the series of webinar for all the healthcare professionals. Having that said, today's topic is the supply chain excellence, opportunities and challenges with respect to medication supply chain. And usually when we speak about supply chain excellence, it is usually defined as improving year-on-year financial performance, outperforming the industry on portfolio of metrics that correlate closely to the market capitalization. The metrics that are usually used are inventory turnovers, operating margin, and return on invested capital. But the real question is that supply chain excellence is really all about this, especially with respect to healthcare domain. The answer is no. It is way beyond that. So what are the real parameters that drive supply chain excellence? And what are the opportunities and challenges in these drivers? That's what is today's webinar all about. There are 5 major drivers that we are going to see in the supply chain excellence. They are information, sourcing, transportation, facilities, and finally the inventory. And I have a big panel of very reputed healthcare professionals today joined with me in this webinar to discuss on all these drivers. My first speaker is Dr. Arun Chandar. He's a clinical pharmacologist. He is the head of pharmacy services at Apollo Hospital, Chennai. He heads the institutional ethics committee. He is part of the pharmacovigilance program. And he's going to brief us on the first major driver, that is on information with respect to supply chain excellence. I request Dr. Arun to take over the session from here.
Yeah. Thank you, Balaji and quality team, and also Apollo Hospitals for creating this wonderful opportunity to share our knowledge and also to learn from you all. So my topic for today's discussion is information on medications and other allied devices pertaining to supply chain excellence. Can you move on to the next slide, please? Yeah. So on a broader term, if we could see what are all the information that we need to gather or where we need to source. So what are all the parameters which we need to think? Next. So one thing, it should be reliable and it should be evidence-based. So we should not depend on anecdotal references. And we have to see what are all the regulatory pathways pertaining to those medications. And the last, we need to approach via case-based or a patient care-based approach for informations on medications. So we will see one by one and then we will take it up in detail. Next slide, please. Yeah. So what are all the informations that are reliable, which we need to consider as an authentic is the first one I would say is WHO Essential Drug List. So this is something like, what is essential drug list? So on a whole, globally, they have term medications are essential medications and which has to be there at any point of time in the treating facility. So that is called as an essential drug list, which will be revised in a couple of, once in 2 years by WHO. The same thing every country will adopt, and according to their needs, they will form something called National List of Essential Medicines, which is called as NLEM. And other thing, what is available within the hospital systems are drug info or a medlib, which is a software which gives all informations regarding the drug. And we will develop something called a drug formulary that will be there in the hospital system, which will say what brands are available and what is that particular alternative brand for those things. And we will add or delete some items into that, and that will be revised once in a year. So that is hospital drug formulary. That is a reliable source of information. So other than that, what we need to see when it comes to new drugs. So first thing we need to see where it is approved. So what are the approval agencies which we can consider as authentic is US FDA, that is United States Food and Drug Administration. Another is European Medicine Agency. And in India, it is called DCGI, which is Drug Controller General of India, or CDSCO, Central Drug Standard Control Organization. So the drugs which are approved by these bodies are considered to be an authentic source for a drug, and where we have to, where we can purely rely on those informations, and that is authentic. So other than this, if at all we are not having any kind of direct approval from US FDA or EMA or DCJ or CDSCO, so what we faced during COVID. So what is being seen is we can adopt for guidelines. See, there will be a lot of guidelines that will be issued. So during COVID, we got guidelines from ICMR. So those guidelines are the reliable source of information for medications. Another thing is expert consensus. Expert consensus is something like when you can't arrive at a decision of how to manage this particular patient with the medications, we rely on the experts. So the experts are a group of consultants who are in that patient care, and they arrive at a consensus with their different specialities. That consensus can be taken as a protocol for managing the patients, like how we had for Apollo COVID protocols. And last but not the least, prescribing information leaflet. This is a kind of a Bible whenever you're going to approach any medication. So because whatever the information that is available in the prescribing information leaflet, so that is the guide for that particular medication. So that is a reliable information where a practitioner should, and also a pharmacologist or a pharmacist should educate the healthcare professionals in the usage of those medications. And other than that, your regular source like reference textbooks, so that will be used as an important source or a reliable source of information, which will ensure medication safety inside the hospital. Next slide, please. Yeah. So other thing which is very important is evidence-based. So evidence-based is we should not rely on the anecdotal reports. So what I mean to say anecdotal reports is, so if it is a single evidence, for example, a single practitioner says that based upon my experience, I'm considering this particular medication as effective. We cannot take it as a an information which is evidence-based. Evidence-based informations are those that is published in the journals and the published data. So that is available in the public domain. So that is an evidence-based information in textbooks or in the public domain. And PubMed indexed, which is actually the reliable source for all the scientific data, which can be accessed through this particular site. That is PubMed or NLEM, we say. Another thing what we need to see for evidence-based is the periodic safety update reports for each of the drug that will be published once in 6 months for any drug that is in the country. So that is periodic safety update reports. And also PVPI sends drug alerts or signals. That is based on the evidence that is collected across the country. So they will tend to provide this information to all the centers as well as to individual healthcare practitioners. Another thing is we are also using higher medication in the hospitals. So for that, we need to see Institute of Safe Management Practices that will serve as a tool for aiding us to develop the list for our hospital. And what is other important thing which we need to see when you are approaching a medication is that is called certificate of analysis or the bioequivalence data of that molecule. So let me put it very brief. What is bioequivalence? So whenever you're approaching a molecule, say for example, there will be an original molecule and there will be a generic product. So when a generic product has to be taken into the system, we need to see what is the bioequivalence of that particular molecule, because that bioequivalence is something which is going to determine the therapeutic efficacy of that particular product. So that bioequivalence will be there in that particular molecule. So it should be always above 90% for approval, and it may be in the range of 90 to 125%. That is an approval criteria for DCGI. But however, as a pharmacologist or a pharmacist, we need to approach and see if it is more than 95%, then it will definitely exhibit the therapeutic equivalence, which is expected out of that particular molecule. So that is one of the important evidence we need to see while approaching a medication. Next slide, please. Yeah. However, considering the fact which are reliable and evidence-based, what we need to do as a responsible pharmacologist inside a hospital is we need to see whether the regulatory approvals and the regulatory guidelines are properly followed, and is that a hospital compliant to those practices. So that is very, very important, because it is always depends on when you are when the medication is being used, that particular information has to be conveyed to the healthcare professional, because we have the responsibility of doing that. And also there are many accreditation bodies. Important thing is, in the national level it is NABH, and the international level it is JCI, that is National Accreditation Board of Hospitals and Joint Committee International. So based on this norms, the medication management policy is defined for a hospital, and we need to comply to those requirements, which is very, very important. And with the newer thing that is called National Medical Commission, which is previously called as MCI, Medical Council of India, there are set of rules to prescribe medications and to how to write a drug chart. So all those things has to be complied by the prescribers who are actually prescribing the medications within the system, both in inpatient services as well as outpatient services. One important thing is the name has to be mentioned in capital letters, the drug name, and it should be in the generic form. So that is very important thing. And the other one of the statutory important thing to look into a tertiary care hospital or a hospital which treats many complexities, it is narcotics. The narcotics are the important segment where there needs to be a continuous vigil, because it's a direct statutory requirement. So that has to comply through Narcotic Drug and Psychotropic Substances Act. And also we need to see Drugs and Cosmetics Act for each of the product, whether it is compliant to the system, whatever the policy we are dividing. I mean, we are actually devising for the hospital, that should be in concordance with that particular act and rules, because we have to obey our state of land or law of land. Next slide, please. Yeah. So what we actually gather as an information from case-based or a patient care approaches, while doing the bedside rounds and clinical discussion, we tend to gain a lot of information through that practice of medications. And also we may think on what is that medication that the patient has already been taking. So that is one thing called a medication reconciliation. So this is also determine so how we are going to have those medications inside the hospital. And also on when we see about drug repurposing, what we actually did during COVID, when we repurposed lopinavir ritonavir for the treatment of COVID. So that is called drug repurposing. That is the drug which is available there for a particular indication, can it be repurposed for treating another infection, which is exactly we did while treating our COVID cases, that is with lopinavir ritonavir. Another thing we need to see is individual case safety report. That is, whenever the patient is getting admitted in the hospital, if there is a specific reaction to a particular medication, we need to see that particular information, and then that will be very useful for determining the hospital policy on medications. And two important things other than this is high alert and LASA medications, how we are arriving that information. Already I'm just reiterating it. It is through Institute of Safe Management Practices, where we need to get that list, and then probably that has to be there inside the system. And one more important thing is, for the many higher value medications, it is drug infusion protocol that is very, very important, because these are high value medications and that has to be handled with care. And as a pharmacologist, we need to have put our brains together, and then we need to set infusion protocols so it will be easy for the healthcare providers to administer the drug. So moving on to the next slide. So I would like to summarize my presentation. So information on medication that has to be reliable and accurate, that is very important. And the best practice is always evidence-based. It should not be an anecdotal approach. And we need to believe in the process. And the sustenance of the process must follow all regulatory pathways, which is very, very essential, because whenever there is an outlier, we are, bound to answer all those things. So that is very important. And always there should be a vigil on patient care that is required for constant update of information, because based on this information only, the sourcing of the drug can happen, and that can go without any interruption. So with this, I would like to thank the audience for your patient listening. I would like to thank also Apollo Hospitals for this wonderful opportunity. Thank you all.
Uh, Thank you, Dr. Arun. But your role is not over. I
Yeah,
do have a few questions, and we will get back to you during our panel discussions.
sure.
Because information plays a very important role, and that is the first step in the supply chain excellence. So we do have many queries on that. We will get back to you on that. I will move on to my next speaker. The next speaker is, I'm very, very pleased to introduce the speaker, Dr. Nandish. He heads the Department of Clinical Pharmacology and Research at Apollo Hospitals, Karnataka region. And he's again a member of Pharmacovigilance Committee, and he steers the antimicrobial stewardship program for all the hospitals in the Karnataka region. He is involved with JCI and NABH accreditation activities in all the hospitals. He is involved in training of DNB students and also the PharmD preceptor at all the hospitals in which he works. He is going to detail about the sourcing, the role of sourcing in the supply chain excellence, especially with respect to medication. Over to you, Dr. Nandish.
Yeah. Thank you, Balaji. Thank you for this thing. Good afternoon to all the participants who have just logged in into this particular important webinar as such. So my particular topic would be basically on what's the parameters which are involved with sourcing of medications. So how do we source our medications, from where do we get our medications, how do we stock it, and so that would be the main particular agenda of this particular discussion. So coming to the main supply chain vision and goals, where I'll be giving a brief introduction of what's the process flow. It's mainly to ensure what's our particular vision. It's mainly to ensure timely and uninterrupted supply of safe and quality medical supplies at the hospital. This could only be done through a well-planned, effective, and an efficient selection, procurement, storage, distribution, and evaluation system. And basically, what's the main motto of all this is to ensure that we provide excellent patient care and also to achieve service excellence to the highest standards. What's the main particular goals with supply chain which deals with is to ensure patient safety. We have to ensure that we maximize the patient safety. We have to ensure that the products which are coming into the system are quality driven, are efficient and fit for use. And we also have to also ensure that we identify any particular significant risks which are involved with the supply chain system. This could be with counterfeit products, which could be with availability of monopoly items or life-saving items as such. Next slide, please. So coming to the supply chain management cycle, which I'll just give a brief overview. My other fellow speakers also would be speaking about this. So I will be like only taking across the point which deals with sourcing of medications. Again, this particular cycle is basically to ensure, as I said, maximizing the patient safety, and this could only be done with a collaborative approach. So the main cycle involves with planning. After planning, what's our particular inventory, then how do we procure our medications? And when we procure our medications, how do we regularly inspect these particular medications for quality, for billing, and other particular parameters? And what are the various storage and inventory control processes which are in place, which will be spoken in the inventory management discussion? And how do we distribute it across to the various distributors and also to the patients? And basically, Dr. Arun has already spoken, what's the clinical outcome review? So how do we actually review this particular new products which are coming into the system? And then later, the evaluation of these particular vendors from whom we are actually like procuring these medications from. And at the end, if at all we do have to condemn or dispose any particular thing, we budget the same thing accordingly. So this constitutes the entire particular cycle. My main particular topic would basically be on procurement, which is basically with vendor. How do we select a vendor? Who are our authorized distributors? And how do we evaluate a vendor? Next slide. So this is basically the process. Dr. Arun clearly explained based on drug information. The important thing with supply chain management process is to ensure we do something known as demand forecasting. All of us would have been through COVID from the past 2 years. We didn't know that COVID existed or anything. So how do we plan across in procuring these essential medications which are required? Certain things are because of seasonal changes. Like for example, during a flu outbreak, we might require more amount of flu vaccinations and other things. So based on the particular demand, we forecast what are the requirement and accordingly we plan. Based on that, we also put in a particular budgeting, which is required, which is very much important in ensuring inventory management. And then how do we select and source our particular vendors? This is basically based on safety and quality parameters. It could be both on-site evaluation and also it could be off-site evaluation. And this decision based on sourcing, it's a collaborative approach which involves multiple stakeholders in selection of these particular vendors. So once we have selected and sourced the particular vendors, next would be the procurement process, where the purchases are made through the hospital management system as such, with good inventory control practices. We then receive and inspect this particular medications during the time of transit to see for whether it is safe to use and whether it is the integrity of these particular medications are good. And also the last thing is storage and distribution across in the hospital, both in IP areas and also in the OP areas as such. How do we give it across to the particular patient? And last but not the least, the most important thing is how we evaluate a particular vendors. This is by doing a retrospective analysis of the supply chain, which I'll be talking in my next particular slide. Next slide, please. So this is basically how we evaluate our supply particular chain. So how it goes from the manufacturer to the patient. To limit myself to only sourcing of medications, I would mainly do it like how it goes from the manufacturer to the particular patient. The main important thing is, as Dr. Arun clearly said, drug monograms and GMP certification is most important for ensuring efficacy of a particular drug and we get the right drug into a particular system. These particular certificates, it should be either FDA approved and it should be a labeled particular product. There should be drug monograms which are available as such, which offers as a source of information to the clinicians, to the nurses, and also to the pharmacists as such. And there should also be a certificate of analysis of these particular products that they have passed the quality tests as such, so that only the efficient drugs which have come across through the particular system, we get it into and put it into a particular formulary. The other thing which I would want to tell about is a vendor site and validation, which is a key particular thing. We either do it biannually or annually. And this thing mainly depends upon whether the storage facility of this particular medications where the distributor is giving to us is sufficient, whether they do have a cold storage facility available at their site, and what's the type of transportation and facility which they have, whether do they have a pest control document which they have, whether it is pest free, how are they storing the medications, whether they have their appropriate licenses, and how are they handling this particular medication. So this is mainly what we actually evaluate a vendor on. Next slide, please. So coming to how we evaluate it. So performance of this particular vendors is actually being tracked and monitored periodically. As I said, it could be twice in a year or it could be an annual one. So the important main particular 4 parameters on which we actually rate a particular vendors is based on the quality of service, is based on the pricing, is based on the efficiency of the fulfillment of a particular purchases what we have put. That's the delivery part of it, and what is the kind of facility we have. So we give a percentage basis, like utmost important would be the quality of the drugs which are coming into the system. That plays a vital particular role. So once we evaluate this particular vendors, we categorize them as A, B, C, and we ensure how much amount of fulfillment ratio. We ensure that most of our particular vendors who are authorized vendors have more than 95 to 98% of a fulfillment rate, fulfillment criteria as such. And what are the documents which are more important when tracking a particular vendor is to see the every particular hospital should have an authorized distributor list, and what are the items which are available with them. There should be a CPU agreement, that's a central purchase unit agreement with them, valid drug licenses of the distributor with relevant GST details, PAN details, and the other details as such. How are they maintaining their particular facility? The calibration certificate of the cold chain system, and we also do an evaluation of this particular vendors on an annual basis through regular audits and verification. Next slide, please. So what are the, as we said, it's how we identify our opportunities and how we can excel. So what are the associated risks which we can find out in the supply chain? It's with regard to stocking. It's with regard to operational costs which are involved, and it could be with storage and transportation, which will be spoken by my next particular speaker. The main thing here I would want to say is the risk drivers which are involved out here is basically seasonal diseases which are there, the demographic variation across the particular country, the changes in the rating, the fluctuations as such, and if at all there are any government related duties and other things. So this is how we evaluate our risk drivers. And how we mitigate the risk is, it's very important to identify our domestic vendors, have a domestic vendor as such, maintain a sound inventory process, increase your vendor base, ensure you have an annual rate contract with them, and make sure that you have a good rapport with all these particular manufacturers so that they entertain your particular requests. Next slide, please. So, as I said, the important thing with supply chain is how do we ensure legitimate drugs enter into the system. Now, this particular slide, usually it's from the manufacturer to the patient, wherein the manufacturer will produce the particular medication and distribute it to the distributors, then from there to the primary wholesalers, which then later goes to the various pharmacies. It could be the retail outlets, it could be the hospital-based pharmacy, and then to the patient and attendants. Now, in between this, there are many sub-distributors and the parallel trade sellers or anyone who is there, where this counterfeit manufacturing of these medications could occur, and these medications could be put in place. So how do we avoid it? We ensure that we take this particular drug, the photograph of that, and how the manufacturing and the packaging of the drug would happen from the manufacturer, have this as a criteria, and we always check on receipt of this particular drugs that there are no counterfeit items. We see for the labeling, the type of printing, the font of the particular name, what's there on the packaging as such. So this is how we ensure that counterfeit products do not come into the system, and we do not allow illegal distributors to come into the place for selling of this particular medications. Next. Next, the other information which usually comes across is from CDSCO, which puts out drug alerts on a monthly particular basis. They test particular samples, they see for the quality analysis of these drugs and see for whether it's for standard quality or not of standard quality, whether there's any spurious drugs, whether the branding is different or something. So based on these particular alerts also, we can put mechanisms in place that we do not get these particular products into our particular system. Next slide, please. I would just want to end my particular slide and hand it over to my next particular speaker. As I said, the supply chain associated risk is basically with discrepancy with the quantity, the strength, and the dosage form, and the counterfeit products, which I've already explained. The next particular speaker, my colleague, Dr. Minal sir, would be speaking about the facility and the storage, which involves with the transportation risk and the cold chain maintenance of the system. So thank you, audience, for your patient hearing. Thank you all. Thanks for the opportunity for me to for providing me an opportunity to speak on this topic. Thank you.
Uh, Thank you, Dr. Nandish. Your presentation was very comprehensive. I think it covered end-to-end particulars of sourcing actually. And sourcing, as you emphasize, plays a very, very important role in achieving the excellence in supply chain management. Thank you. Again, I do have a few questions for you. We will catch you up with the catch you up at the end of the session. We will move on to the next speaker. The next speaker, basically, I am very honored to introduce the next speaker, Dr. Mrinal Das. Dr. Mrinal Das is a clinical pharmacologist who has got over nearly 20 years of experience in the field of medication management, medication error, formulary management, pharmacovigilance, antibiotic stewardship program, research, and whatnot. He is the person managing the entire medication management and use for the Eastern region, covering all the major hospitals of Apollo Group there. He is going to take us through today the role of facilities and transportation in supply chain excellence. Facilities and transportation is a very, very important priority in the supply chain management of medications. So let's see what Dr. Mrinal has got for us. Over to you, Dr. Mrinal.
Thank you, Mr. Balaji. Thank you to my seniors and colleagues and Apollo Hospital for giving me the opportunity. I hope I am audible. So I'll be talking about this, transport and facility. So kindly go to the next slide, please. Taking you through the, this supply chain process, which has already been shared, but then in perspective of the transport and facility, the drug, which will be, manufactured in the manufacturing facility, it will be, distributed through transport into the, company carrying and forward agency, that is the hub, the company CFA, and from there it can also be transported into the central warehouse, which may be regional warehouse. From there, it will be coming to the wholesaler distributor is there. So that is also, transport and facility has been involved in that. And after that, it will be, coming to the hospital pharmacy through transport. Then it will be stored in the pharmacy, and from the pharmacy, as per the patient needs and, physicians, requirement, it will be informed and it will be dispensed to the respective patients. So this is the, supply chain process where the transport, then facilities are involved in that. So can we go to the next slide? Yes, thank you. So transportations, let us understand this. So there are modes of transportations. One is, this air transportation by the flight, plane is there. Then there are water transportation. So here I'm talking about, drugs which are coming from the different country. It may not be, manufactured in India. It might be, manufactured in, European countries, US, Russia, like that. So that, in that connection, this transportation modes by air might be there. So in that connection, water transportations is also important mode of transportations. And then next one is the land transportation. So these are the modes of transportations of the, items and, drugs through which the, it reaches the respective, patient care areas. Let us also understand about the tools of the transport. The tools definitely by flight, then by ship, then by vehicle, and also inside the hospital, inside the, state, inside the, country, there might be human beings involved. Inside the hospitals, it is delivering to the respective, patients' care areas by the humans. So these are the transport tools which has been used. Now, as per the topic of our discussions, let us also understand the challenges and opportunities of these transportations. As we have already heard about from our previous speakers about this pandemic situations, there are lockdown situations. So it might be international, it might be national. So the challenges are there. So that you already, experience about this COVID pandemic, how it has been totally stand still in connection of this transportations, that your lockdown, sudden lockdown, which is there, is total, country has been stand still, and then whole world has been at, standstill. So that is what it is very, very important. The challenges are there. Then again, right now we are also in the middle of one of the war, which is there. So the war, then the riots, which might be there, can also causes, challenges in the transportations. So it might be international, it might be national. Then which we experience, which, pinching our pockets, is the high fuel prices. Again, with the war and the riots and everything, pandemic, this will also, increasing more. So that is also, kind of challenges. The mode of transportation will be definitely affected by this high fuel prices. Then again, accident and vehicle breakdown. We never know how an accident might happen suddenly. So that is also, kind of, challenges where the, important drugs, important items might not be, delivered to the respective patients at the right time. So these are another issue is there. Then coming to the long route of transportations. So if, some country is, prohibiting the, passing of the vehicles, the air space is been, kind of prohibited, then the air route has to be, taking a long route. That we have already, understood in the Middle East countries where there is a frequent war is going on, and then the, airspace has been prohibited for, travel. So that is the flight are taking a long route. Similarly, in case of ship and water transportation, if there's some, vehicle has been, prohibited in some of the, canals or some of the, routes, then again they had to take a very long route. So that is again time consuming. Also this, a lot of, fuel will be, used in that, and both will definitely affect the, challenges in, delivery of the medications. Then bad road. We all Indians, we know how the roads is there. So that is what it is very, very, important in certain countries. But then in Europe and States, it might not be the case. Then important thing is the cold chain maintenance. Say like the biologics, some temperature control, medications, how this will be delivered, maintaining all the cold chain, maintenance system. Some of us has already understood about the Sputnik vaccinations when it has been delivered to the respective, hospitals and countries. So that we have already understood how, very, very important it is. So like that, the other, cold chain medications or items would be definitely a challenge. Then again, the vehicle maintenance, it should be in a sound, conditions. Then only it will be, giving the, right time maintenance and, delivering the right drugs or items at the right places. What are the opportunities with these challenges that we need to, really understand and really, focus on so that it doesn't happen, or we can have a, contingency plan in that. So what you can do? We can do optimization of the stock and its evidence that yes, we have. So we need to foresee such kind of, with our experiences about the pandemic situation, the riot situation, so on and so forth. Then we need to optimize the stock so that at worst scenario, we can have the stock of this, essential medications. Then again, the opportunities would be the alternate transport facility. It might be with the flight, or there should be a plan that if it doesn't happen, what is the plan next? That is the, alternate source of, transportations. Then cold chain facilities and documentation and validity that has already been, shared, that also be there. Then very, very important is we call it HIRA, hazard identification and risk assessment plan. So this is very, very important to know that if we have it in our, armory and in our plan, then definitely we can avoid any of this, challenges which are there. So then again, coming to this vehicle documentations, vehicle maintenance and its validity, and also to the respective drivers who are driving the vehicles, their documentations, their validity check is very, very important. And delivery turnaround time, we call it TAT. So it is also very, very important. If it can be, optimized and maintained, then definitely this can be averted, the challenges. Then evaluation of the vendor has already been, touched upon. So I'm not going into detail. So that is the, opportunities which we can bank on. Thank you for the next slide. So coming to this facilities already been touched upon a little bit. So I'm going a little bit about elaboration is that the licensing of this facility is very, very important. So without licensing, even a pharmacy cannot run the shop. Like that, there are big facilities that we have touched upon, the manufacturers, the company CFA, the warehouse, they have this licensing. So it is very, very important to have that one. Then the security of the system. We are also seeing about the field forest system, and so that is also very, very important to have this security system right from the facilities, right from into the regional central hub, and also into the pharmacy, and also in the patient care areas. So all this lock and key system or any other system which will provide this facility about the security would be very, very essential. Then cold storage facilities. Okay, the AMC of the cold storage, frequent breakdown maintenance, preventive maintenance, the licensing of the cold storage, maintaining of the cold storage, monitoring of the cold storage is very, very important facility. Then that is not all, the power backup system, because all will be running by power. So if there is no power backup system, because all our machinery, it might break down. So that backup system is very, very important. Then coming to the inventory control, that will be elaborated by Dr. Nipul in the next speaker. So, but then I'm not going into detail. Then optimum space is very, very important, because the pharmacy, to run a pharmacy, they need a optimum space. Like that, this manufacturer, the CFA, the optimum space should be there, to have this, facilities of these items and medications. Then infection control on this, then prevention of this facilities is also very, very important. Then also very important is the expiry management process, equipment management process of the inventory and facility. Then logistic management process is very, very important. So coming to the challenges and opportunities, challenge would be, as I have already shared, might be pilferage. So the hospital and the this MNCs, the ACO should have this pilferage policy and SOPs for theft control, spurious drugs and items already shared by Dr. Nandis. Then accident and fire, these are the challenges might be there in the facilities. Cold chain maintenance due to power breakdown on any of the natural calamities, so on and so forth, might be there. Challenging in controlling the humidity in hot and humid climates, like certain areas of the India. So that is there. Then space, then delivery turnaround time, equipment management, expiry management. These are the challenges in the facility that we need to really have this plan. Coming to the opportunities of improvement, that we can have an SOP, standard operating process and procedures, and establish process for the pilferage and theft preventions. Then checking the original versus spurious comparison process in case of medications or item is very, very important. That has been touched upon by Dr. Nandis. Then optimize facility as per the regulations, document check for the optimization of the facility, check the power generator, backup of this power generator, then documentation check, then annual maintenance check, then renewal check, everything should be at place. Cold chain facility check and its maintenance. Optimize facility management system for prevention of the accident and any fire is there. Then vendor site visit and evaluations on regular basis, which has already been touched upon by Dr. Nandis, is very, very important. Then at the same time, the opportunities would be, to check the equipments, expiry management and logistic management would be very, very important. Can you go to the next slide, please? So these are already, touched upon by my previous speaker about the supply chain evaluation. So here are the points and, pointers where the supply chain can be evaluated about vendor site visit and validation, supply are checked for, and that is what is the few points are there where it can be checked about batch expiry, then appeal to the patients where the patient has been delivered by the medications with name and image ID is there or no. So every aspect of the supply chain, each and every nook and corner can be evaluated, and based on that the proceedings or the process for correction should be there. So can we move on to the next slide, please? So as Dr. Nandis has already shared about the retrospective tracing of this, drugs or items, we call it batch analysis and batch tracking. So each and every, processes, this batch tracking can be sought after, and then the evaluation of the system right from the manufacturers, taking the documentations and CFA, then warehouse, then into the pharmacy, and also into the patient, whether the right batch has been procured and is been delivered to the respective patient or no, can be checked, and that will give us the validity of the transportations, the timings, and the facility at large about this supply chain systems. Can we move on to the next slide, please? Yeah, thank you. So this would be the summary of my presentation. Is that so? In a common scenario, case scenario, the approach would be for a supply chain management. There might be challenges. There might be monitoring system, and what are the contingency plan for that? So that we need to understand in a summary of this slide. Is that inventory control is very, very important. These are the challenges as well. Delivering the urgent consignment in time of certain vaccinations, certain essential medications like crash cart medications, emergency medication is very, very important. Return of the short expiry and recall of consignment is important as a challenge also. Transport of the cold chain items and without breaking the cold chain is very, very important. Damage and breakage during the delivery we need to really sort for. Check the balances for the spurious items is also important, which is a challenge in this kind of situations and this kind of certain countries. Natural calamities leading to this, issues in transport and storage, we have a contingency plan for that. Then product withdrawal without, second line items is very, very important. We know with levosimunda, there is no, item is there, second line, but then is there. So storage of these life-saving items, these are the challenges that is there in this kind of scenario. So the monitoring system would be, a helping hand in that, so that it can leading us to the contingency plan. So what is the monitoring of this? So for the inventory, it might be ROL and ROQ, reorder level and reorder quantity. FSN, VED, ABC, these are the inventory management analysis. FIFO and LIFO is also the same. So that would be definitely elaborately told in the next speaker. So that process should follow about the monitoring. Then only quality time maintenance for the TAT of this routine and urgent consignment should be checked again. Temperature record, data logger, in transport, that should be checked. That have to have a mechanism. Process of spurious checking of these items, and it should be authenticated. Then backup transport plan and arrangement, backup storage facilities should be also there. Having an alternate product for the supporting clinical conditions should be there, and keeping check on the life-saving items on regular basis with a quality monitoring is what needs to be monitored. So what is the contingency plan in that case? So implementation of the good inventory practices, we call it GIP, is very, very important to sustain the shortage of these items. Quality monitoring in stock keeping days is very, very important, and it should be optimized. So it might be according to the different areas and SCOs, it should be optimized in that regard. Transport, return and delivery backup system should be there. Cold chain backup system should also be there. And spurious drug identification process, drug recall process on that identification should also be there as a contingency plan. And backup storage facilities and backup clinical support product for the life-saving items should also be there. Along with that, separate stock for the life-saving items and sustenance of the same should be there. So this is what transport and in this facility should be there. So with that, I am thankful to all of you all. Thank you so much. Thanks.
Thank you, Dr. Mrinal. I think from the content of your slides, how rich it was and how comprehensive it was, I'm sure the forum would have understood the importance of facilities and transportation in the supply chain excellence. Thank you for your wonderful presentation. My next speaker is Dr. Nipul Kapadia. He's heading the pharmacy services at Apollo Hospitals International Limited, Gujarat. He's again a go-to person with over 18 years experience in as a pharmacy head at Apollo Hospitals. He has spearheaded many initiatives, Six Sigma programs. He has championed medication safety at various hospitals, and he is going to take us through the role of inventory management in supply chain excellence. Over to Dr. Nipul.
Thank you, Balaji sir, and the entire quality team, and my colleagues, Dr. Arun, then Dr. Nandish, and Dr. Minal sir already gave a very detailed information in the supply chain. The three pillar, I am talking about the fourth pillar of the supply chain, which is inventory management. Why it is important, and we know that in the last couple of years, in a pandemic situation, how the inventory management plays a very vital role to support the entire hospital clinical services. So I'll be give in very short and detailed information in the inventory management perspective. Next slide, please. So inventory management is a science to ensure the timely, uninterrupted of the safe and the quality medication supply and the medical supply through the well-planned, effective, and the efficient selection, procurement, storage, and the distribution, including the evaluation system, which provide the excellent patient care and achieve the patient service excellence. So basically, it's a science who can be largely lead with the patient care and the patient safety. And we know that the patient safety is our first priority. Next slide, please. So the supply chain management, the inventory management, the main goal is to maximize the patient safety, ensure the quality product availability within the specific time limit. So lead time also very much important. identification the supply chain risk, which is very much important, because we know that there is a lot of risk in the supply chain also in terms of the inventory management. So in first point, the maximize the patient safety. So the procurement decision, which is through the drug and therapeutic committee, because by the proper communication and the with a collaborative approach, we can be better manage the inventory and reducing the cost of the inventory, and the timely provide all the services for the patient care. Also by the quality care and the quality product we provide to the patient, by that we can reduce the patient average length of stay, as well as the clinical excellence also, it is depend on this. And beside this, the risk factors are there in the inventory management. Maybe sometimes due to the counterfeit product we receive, or the some item of the monopoly, some of the life-saving items are there. So there is acute chronic shortage of these items are there. So in that, if we define the proper policies and processes, so by this we can overcome this all the risk. Next slide, please. So this is the basically hospital inventory management, the cycle. It start from the create the medication or the consumable requisition, then receive the medication, then to track the inventory, because tracking inventory is very much important. How much items are consumed, how much items are left, and on that basis we can forecasting for the future also. Then the if any items which are important and it goes in a low stock, so all the automatic alert should be generated. So that help to maintain the proper inventory management, as well as the cost control in the inventory perspective, and return the near expiry item on time by the regular checking and the audit of the stock. So that help to reduce the loss in the inventory. And many of times what happened that to destroy the certain medication, because certain cutting strip or the some of the breakage item we require to be properly destroy with a certain documentation by handing over to the government agency and take a certification from their side. Besides this, the inventory management also help it help to for the investment protection. Then the asset tag also very helpful in the terms of the costly items, majorly in the terms of the stent as well as the implant. In that cases, if we attach with the RFID tags, we can easily control the loss or the any kind of theft kind of the incident in that of the items. Then automated inventory management system also helpful for the various type of the analysis we can do. Then it also help in the execute the supply chain management in a prompt and the efficient manner. Also, again, we can say the track of the inventory level, that high level, low level, and the medium level costing of the items. So that also we can be highlighted, and by that we can efficiently manage the inventory management. The also it help to short the health care workflow, and timely availability of the all the equipment, including the medicines and consumable as per the need of the patient and the hospitals. So by this way, we can be do the effective inventory management, various processes we can be follow. Next slide, please. So basic idea behind this, it's the patient-centric or the customer focus. The inventory management approach should be there. So the right price plus right quantity is equal to the cost effectiveness. So that help. Then second point is right time and the right quality. So the quality of the patient care can be provided to the patient. So currently in affordable healthcare, everybody says, so in these two main points are very much important. One is cost effectiveness and the quality of the patient care to be provided. So maintain this, all the four determines governs the quality of the services we can provide to the patient. Next slide, please. So for the better inventory management technique, certain things we have to be identified in our inventory management on the basis of the type of the items what we have. So basically we have to define the critical item list in the inventory. so that help that zero tolerance on the I would like to say the stock out. So basic this particular criteria, on that basis we define the critical items. One is a life-saving product. Second is a monopoly items, because certain like albumin and there is a monopoly of the items are there. Then certain imported medication, because we know during the pandemic time we saw that many of the injectable item and the medications while imported from the other than the India. So due to the transportation constraint, there is a delay in the import of these items. So that items need to be identified on. It is again on the basis of the analysis and the consumption what we have in a last period of the year. On that basis, we can identify an item with a statutory restriction in the procurement and the storage. Basically, this link with the narcotic drugs and the certain Schedule X medication, where the monthly and the periodically we have to provide the document to the government, and on that basis they give the approval for the further purchase or the procurement of these items. Item with a special storage requirement, basically which include the vaccines items, where the individual particular temperature the item has to be stored, and the seasonal items like remdesivir or the certain COVID-19 or the I would like to say monkeypox virus related items which are required in a certain seasonal time. So these all the parameters we have to be taken care while we define the critical care items, critical item in our formulary. And also these critical items minimum stock also we have to be defined in the system. So there should be no stock out systems, no stock outs happen in the system. So it includes all the items, including the pharma items, surgical items, consumable, and the vaccine also. Next slide, please. So these critical items, many of the items have a very low therapeutic index, and the items are very potent. So on that basis, the tracking of the inventory and the availability of this product from the manufacturing side or from the warehouse of the pharma companies or from the vendors that need to be closely monitored. So in this regard, these all the points need to be considered. List of the critical supplies to be prepared, the sufficient inventory and the critical items to be ensured, the average monthly consumption of these all the items to be analyzed, so the overstocking should be avoided. So by this way we can be avoid the blocking of the finance, ensure the supplies to maintain the sufficient stock. So what happened, the timely all the items are available for the patient care. In the rare cases, the alternative product are suggested by the users. So the same communication has to pass to the end user also. So they are also mentally prepared to be used, and also we can plan the training program in this regards, so the end user can be properly trained for the any alternate products are there. Next slide, please. So these are the various techniques which we can be applied for the inventory management, forecasting, the consumption trend analysis, then the critical item identification, as I already said, then vital, essential, and the desirable analysis. Generally, this PD analysis has to be done on the 6 months basis. Inventory coverage days, how many days the inventories are there on the basis of the consumption, reordering level, and the reorder quantity. The periodically it should be monitored. Lead time, because many of times what happen, the warehouse and the C&F are not very close to your hospitals. It's in the other city or in a remote area or so. At that time, the lead time product wise need to be analyzed. So the timely and the without the stock out, the products are available for the patient care. The ABC analysis that periodically has to be done. Beside this, the SD analysis, that is for the scarcity of the product. Then sometimes this difficult to get the product and easily get the product. On that basis, we do the analysis. Then HML analysis, that also help for the forecasting of the inventory management. High value item, medium value item, the low value items, and just in times, because many of the costly items, basically I would like to say the onco products, the the immunological products where the cost is very high. So many of the times the patient are coming the certain period of time. So at that time, by the proper communication with the end user, we can make the available this product just in time. So we can reduce the inventory cost. Next slide, please. So during the pandemic situation, we know that we face certain challenges in terms of the availability of the items. So the risk management process has to be defined. So first of all, the identify the risk on the basis of the predicted the likely disruption in a global supply chain. So what is the because many of the consumable items we know that are imported from the outside India. Now the government take a very good initiative for the Make in India concept, so that help us a lot. Second is allied with the direct manufacturer, so as the if directly we are in communication with the manufacturer, so we can get the proper information when the timely the products are available. Beside this, assigning the risk, so the advanced order planning is a very important factor. Then bulk material stored on the basis of the forecasting of the requirement of the next period of time of the items. Multiple brands for the orders that also need to be looked, and alternate item sources by the communication, proper communication with the end user. And how this risk are mitigate. So we can say the critical items tracker. During the pandemic time, we maintain similar way the critical item tracker on the periodically we have to define, and that item consumption has to be oversight. So by this way, we can avoid the stock out of the items and the scarcity of the item. And in coordination and communication with the vendors and the warehouse holders, we can get the right information on the right time, so the inventory cost can be controlled. And also the timely review has to be done. What are the consumption pattern is there, what is the end user requirement. So it's a cycle. So the end user communication with the end user, and the trend also that help to maintain the proper inventory management, and to avoid the risk in the supply chain. Next slide, please. So now this is the time for the everybody say about the artificial intelligence. So here I try to be share some of the point how the artificial intelligence help in the inventory management practices. It protect from the fluctuation in the demand, so help in giving the better service to the customers, aids in continuing the supply operation, reduce the risk of the loss, because RFID or the barcoding or the some techniques we can be reduce that part risk or the loss, minimize the administrative workload, because more and more manpower are involved. There may be a chances of the certain level the lapses are there, but with the artificial intelligence and the digital platform, it help to be reduce this such kind of the errors, tries to protect the fluctuation in the practice, makes the effective use of the working capitals. So the we know that always the supply chain in a focus in a healthcare scenario in terms of the profit margin and the profitability point of view, and the financial control point of view. The checks the loss of the material due to the pilferage, the facilitate the cost accounting activates, and the avoiding the duplication in ordering of the stocks. So artificial intelligence and digital platform is helpful for the inventory management practices, and also various analysis what I share in my previous slide. So by this way, we can do in the better way the inventory management practice in the healthcare scenario. And two things are very important. One is a zero tolerance on the stock out, and second is a patient safety is our first priority by the quality care. So thank you very much to entire team to give me the opportunity to share my views on the inventory management practice. Thank you again.
Thank you, Dr. Nipul. I think I really like the way that you had mentioned the how cost effectiveness is very, very important in inventory management, especially with four important parameters such as pricing, quantity, quality, and the time. I really liked, and I also liked your last slide on artificial intelligence. How can we enable, how it can enable the entire process with respect to supply chain excellence. That's the emerging trends. That's where the future goes. Thank you, Dr. Nipul. And with my four speakers, we are also going to get joined by two industrial veterans actually for our next segment. The next segment is about is the real panel discussion. I really want to make it as a rapid discussion. They are industrial experts. They both have over 20-25 years experience. They are currently the chief operating officers of Apollo Hospitals pharmacy division, Mr. Ravichandran and Mr. Jagdish. I welcome to this program. Mr. Ravichandran is managing the inpatient pharmacies, especially the hospital-based pharmacies, and Mr. Jagdish is his responsibility includes outpatient pharmacies. I have many a times uh, I've had good experience with both of them actually. So they are my inspirations on various segments. So I'm really happy that they have joined this program. Um, we have discussed about the key drivers in the supply chain excellence, such as information by Dr. Arun, sourcing, Dr. Nandish beautifully explained. Then we facilities and transportation was explained by Dr. Mrinal, and finally inventory, which includes about the pricing also by Dr. Nipul. The supply chain excellence, I'm sure, is enabled by these drivers, but the results areas are even more wider. It's vast. My first question is to Mr. Ravichandran. Sir, how do you, as an organization, or how does an organization actually has to identify the medications or medical supplies or the medical devices that are at risk of, losing stability or becoming contaminated, becoming defective, or being replaced with counterfeit products or imitation products? Because as a survey coordinator, I have sat through many of the supply chain sessions of Joint Commission International, and this is something that they always come up with. With the countries like ours, this question's becoming more and more important. So, what's your thought process on that?
Thank you, Balaji. As you are aware, we follow the protocol of JCAR, NABH protocols in medication management and use. In this, particular one topic which talks about sourcing of the medications and preventing these, the fake medications coming into the system. That question always is there in the JCA, every things and all. We as a SOP, standard operating protocol, we are having a batch tracking mechanism for that. The products which is being manufactured in India, or it is from the outside also. The batch tracking, not only talking about the quality of the product and the temperature maintained throughout that transport which we are keeping, and some products, not only the temperature, some products really need the the away from the light, and external pressures, temperatures, all these things. So we try to have that complete, process of their, logistic process. We validate the logistic process, and once we satisfied with their logistic process, we, take up the brands into our system or molecule into our system. That is the way. And most of the medical devices, if you talk about the medical devices, it is most of these, patient use medical devices like, thermometers, digital thermometers, or the flow meters, all these things, being properly quality checked by these, our supply end itself. For example, if the product comes from our supplier, it is being, previous to that, it is validated when we receive that one, it is almost error-free or zero error, products which we are receiving. So we don't have any, question about that, part. And yes, for example, storage, they are talking a lot about the storage point. You asked about that, the damage of these things. Where, I have seen that, the lot of, hospitals where we have mostly been stationed at the bottom of that, the lower bottom of the hospital, the storage areas, where we are having these, the rodent issues will be there. Particularly, when it goes to that, the IV fluids, dextrose and all, rodents are very much, fond of dextrose, water. So normally they used to damage these things. So we take that, utmost care in that, pest control also in storage areas. This is the way we prevent those, aspects. And otherwise, we make sure that quality medication is being dispensed to these, patient bedside with utmost care.
Thank you, sir. I think your experience, I think, gave us the answer that we required. I have one more question for you. Last 2 years has really been a trying time for all of us with COVID, and we are slowly recovering. I'm sure the world is recovering. I'm just keeping my fingers crossed that we should never ever, any of our future also, they should not meet such, such a situation, pandemic situation. um, uh, how do you think that supply chain became a very big issue during the pandemic period? We had many countries facing problems with medications availability. They had medical devices non-availability issues and things like that. What are the key ways, in your opinion, which build the supply chain resilience actually? What do you think, sir? What is your thoughts on that?
See, during this, COVID, period, a coordinated effort from everyone, from the, the sourcing, agents, central purchase committee, to these, the down the line, to that, patient distribution level, we exactly coordinated everything. We created a tracker wherein we add that, what is the today's current stock and what is going to be, what was the order to the company, what is the, lead time for the company to supply to us, and what is the consumption of that one, how these, pattern has changed. Everything we started monitoring, morning and evening we monitor that one. And most of the stocks which we have, life-saving stocks which we sourced centrally and we redistributed to all the units based upon their needs. We never allowed these, the individual units to buy on their own these, during this time. We did a centralized procurement of most of the items and we redistribute based upon the need of that location instead of, the things. And the other thing, we started working on the multi-sourcing. Once, when we had an issue with that, the COVID time, we adopted from the single vendor to a multi-sourcing. Various vendors which are having the reputed things, and also make sure that the patient, the medications or the devices which we are getting is from an authorized sources, not from unauthorized sources. If it is from the multi-source also, we ensure that one. So we never ever faced any issue during the COVID time. Yes, we rationed that one. We don't sell that product in the open market through our pharmacies and all, but definitely we given service to each and every patient needed the medication, within the stipulated time, and we assured them also within 24 hours. Today also I'm assuring you, if the drug is available in India, whichever the part of India, within 24 hours, the drug will be made available to the patient. When I'm mentioning the drug, it is a molecule, it is not the brand. Always we used to keep that, molecules readily available in our system based upon the specialty, which every hospital is having that one. So we never ever faced such a issue during this, COVID. The entire team, with the support of this, management, we steered these, the situations, very well. to achieve, a maximum excellence in this, supply chain management?
Thank you, sir. I clearly remember the COVID task force meetings actually, where we have discussed about end-to-end synchronization, multiple sourcings, and for the medication. I think that has really helped. And end of the day, we are the patient is a beneficiary. So patient centricity is a key component here. Thank you, sir. I think that's really good. But that leads us to our next question, and this question I would like to ask Mr. Jagdish. We have, we know that there are opportunities in supply chain excellence, but according to you, how can we quantify these opportunities? How do we go about it? Is it even possible in quantification of these opportunities? Mr. Jagdish?
Namaste, Balaji. Is it audible?
Yes, sir. Yes, it is audible now.
Okay. Coming to the process performance on the supply chain can be monitored through this perfect order indexing and supply chain cycle time, as well as the order fill rate and inventory turnover and inventory velocity and the gross margin return on investment, warehousing cost, supply chain cost, and the inventory days of supplies can be monitored with this through KPIs. Generally, we can measure one supply chain with this following: one-time shipment rates and on-time delivery, accurate damage-free in full deliveries, and correct documentations including the deliveries. For example, 100% of time shipping and delivery rate, that is a very important in the supply chain. Particularly in the pharma industries, time is important for the readily available product to the customer or the patients, and the bedside deliveries. All those things are considered as supply chain excellence.
Thank you. I'm sure most of the hospitals, do have these metrics monitored on supply chain. If not, I'm sure they'll be adding it to the list. So that's very nice of quantifying the opportunities. But when it comes to some special products, especially say biological gene products or cell products, this question I would like to ask to Dr. Mrinal. How do you forecast the key facilities required? Because I'm sure the world is now moving, the trend is going towards all these products, biological gene products and cell products. So what are the key challenges that we are facing now, and what are the opportunities for these products, especially, with respect to facilities?
Yeah, thank you for that question actually. So the examples, for this biologics, kind of hormones, then blood products, then cytokines, growth hormones, vaccines, gene and cellular therapies are there, fusion proteins, insulins, interferon. We all know monoclonal antibodies. These are the products. So these are basically cutting as research product, and this has for curing of the various diseases. So these, this kind of natural living sources and biologics can be extremely fragile. So that is what it is very, very important. So cold chain in the sense that we have already talked about is very, very important in this scenario for these vaccines and biologics. The cold chain maintenance should be there at a constant temperature for this data logger. And then, here also this AI would definitely come in. So that cooling of this, and refrigerations, say like this cryogenics and ULT storage is what is very, very important. So these are the challenges as well. Then it should be preserved also. So that is particular time it has. So this transportation with the particular time without any delay, maybe flood, maybe natural calamities and all that should be, there as a challenge also. So, so that is what it is very, very important. Then coming to this, overcoming all these things that we have already understood in terms of Sputnik vaccinations, what we need to have a process, rock solid process. Then we need to have a SOPs and training. Without training, it is very, very difficult. Before coming to the Sputnik, there are a lot of training, how to handle these vaccinations, what consignment it would come, what would the time limit will be there. and that is the communication which is very, very important. So in this case scenario, certain cold chain products, there are certain important this mechanism in which dual redundant refrigerations and unit with integrated genset is very, very important, in which it will have this minus 10 to minus 25 degrees Celsius. It can have this because this is having integrated generate electricity, so that will not be problem. Then for minus 40 degree and minus 65 degrees Celsius refrigerations of this product, then dual redundant deep freezer container is there, so it can be also utilized in that regard. Then there are other biologics in which this umbilical cord that should be certain time limits are there that should be maintained in this particular storage, and then transportation are there. So that is what is the challenges, and these are the opportunities in which we can contain this kind of challenging products. Thank you so much.
Thank you, Dr. Mrinal. I think well said. But when we talk about the emerging trends in planning, in information, in sourcing, in facilities, in transportation, Dr. Nipul in his presentation clearly explained the risk part of it. There is quite a risk involved in each of these processes actually. So my question is to Dr. Nipul now. What is the risk appetite in this whole end-to-end process? Especially, of course, you mentioned about the inventory management, which has got a biggest appetite when compared to other components. So how do you mitigate it? If an organization has to excel in supply chain, what it should be doing to manage the risk appetite?
See, Balaji sir, there is a first I would like to say what is how to define the risk appetite. So the risk appetite is the level of the risk that organization is willing to accept while pursuing any objectives, and before any action is determined or to be necessary in order to reduce the risk. So there is a 7 form of the risk are there in the inventory management. Basically, how we can be defined or classified in this. One is a fraud forecasting, which is very much important. And we saw in the couple of years in the pandemic situation, every day the forecasting are changed. So in a deeper manner, if we do, and the two-side communication means communication not only from the one side, the communication from all the aspect from the manufacturer to the end user, all the levels, if the communication should be perfectly understood and that implemented, the risk can be reduced. Secondly, the main risk is unreliable suppliers. So that, but in our system, there is a very robust systems are there, the CPU and the things are there, so that help us a lot. Third thing is a shelf life of the items. So that is also because certain items very less shelf life, like certain vaccines, like influenza vaccine, we say it's available in a strained manner. So the shelf life is already 7 to 8 months. Besides this, some of the nutritional products also have a less shelf life. So that also, and also if we say the margin in terms of that, and the costing part is very high in while we place the inventory of that item. Third, the fourth important thing is a theft. So there is again a chance if properly the auditing manner and the proper CCTV camera or the auditing systems are not in place. So and the control system is not there. So that maybe create a loss. Then it connected with this, there is a loss because many of the items, many times what happen, company not take back. So that items need to be closely monitored. The stock and inventory need to be focused so we can prevent the loss. Then the product damage. So the storage of the product is very much important. The items should be stored in that manner. The item should not be damaged, and the costly item and the certain temperature monitored item need to be proper attention to be done. and the life cycle, that is also very much important. Beside this, the factor that influence the risk appetite, that include the culture of the organization, how the training and the development program we plan for the people who are handling the item, who are using that item, then industry and the organization, how it work, and what are the facilities are provided. Then the competitors, that is also one of the risk factors, because in current scenario, the people are not means going for the how they learn, but they are going for the how they earn. So that by the training and the proper communication and development, we can be retain the people. So that help us in the maintain the systems in the inventory management, and the practices we can be strengthen, and type of the initiative what we are pursued. That also very much important. So the kitting manner, or the any initiative we can be started. So with a collaborative approach we can be done. So that help us in the proper inventory management. And the current industry position, it's very dynamic, so that also need to be considered. So in my view, or globally, the three essential points are very much important for the effective inventory management. One is a inventory forecast analysis, optimize the purchase orders, and the inventory control. So these three things are very much helpful to overcome these challenges.
Thank you, Dr. Nipul. Well said, actually. That brings us to the close of this very enriching webinar. I'm sure, like I have learned a lot personally in today's session. So I'm sure the entire, all the listeners, or all the people would have definitely learned and would have got to know more info on supply chain excellence. If I have to conclude the session with the key takeaways from the session, I would like to put it as 5 important points. The first point: we as healthcare professionals, we have always been taught put patients first. Patient as a patient in the center, and we all have to work towards them, actually. So patient, embracing the patient centricity, that is very clearly brought out in each of your presentation, in each of your discussion. So that should be the first point. The second, of course, is the awareness and analysis of segmented supply chain markets, where we should have a very clear information, very clear sourcing requirements, on supply chain. That was very well brought out by Dr. Arun and Dr. Nandish. That's the second point. And designing for business agility, because whether it is pandemic, endemic, or whether it is a natural calamity, any other natural calamity, the business has to go on. It should be continued, and the design should be perfect. So designing the business for agility is a third component of the excellence. End-to-end synchronization, very well brought out by Dr. Nipul, and also Dr. Mrinal, and Mr. Ravichandran, and Mr. Jagdish in the answer. The end-to-end synchronization is very, very important. We all have to have very clear information in each of these processes for each of the products, be it medications or medical devices. Synchronization is very important. And finally, leveraging the advanced optimization process. Optimization can come in terms of cost effectiveness. It can come in terms of utilizing newer, embracing newer technologies. Again, Dr. Nipple brought out artificial intelligence. So encouraging that, that is the fifth most important factor. I think if all these 5 factors are considered, I'm sure any organization, any healthcare organization would definitely excel in their supply chain management process, and they can easily embrace the opportunities, and they can mitigate their challenges. With that note, we will conclude this session. I do have a few requests for all the members who have joined. This web program has been joined by over 200 people in the Zoom session, and it is also live streamed in YouTube and Facebook. There have been many views. Thank you. I sincerely thank each of you for your patient listening. I think with your participations, we can do more and more sessions like this, which will definitely help many organizations. We have come up with this knowledge series, and it is there till 17th of this month, till the World Patient Safety Day. So please do join every day between 3 and 4:30 p.m. For all the knowledge series. And tomorrow we do have a speaker program for medication safety patient perspectives at 3 o'clock. The structure of the program and the topic of the program itself, it's very inquisitive. I'm sure that I'll be participating. I really request everybody to join the program. All the participants who are participating in this webinar series for all 6 days may stand a chance to win a lucky draw. And we shall get in touch with them about with the winners shortly. And as a continual improvement measures, we request you to share your valuable feedback. Again, my request is I have 2 requests. One, please participate in this program so we can do more and more programs. We will have that energy and enthusiasm to do more and more programs like this. And second, please do give your feedback, and that will help us for a further improvement. We do have a patient safety club. It's called as Apollo Patient Safety Club. It's been organizing various learning programs throughout the year, webinars and conferences. We urge you to take membership of a patient safety club. We do have more information about patient safety clubs. We will definitely mailing you about this. Our upcoming 9th International Patient Safety Conference. Believe me, it is one of the best patient safety programs, patient safety conferences in the world. It is our 9th season this year. It's going to happen in Delhi this time between 1st and 2nd of February 2023. The pre-registrations are open. You may please check the details on our website that's been mentioned there, www.patientsafety.co.in. Please send in your queries at the given email ID or call the given number. We'll be happy to share more information. With that note, I would like to thank all the panel members and all the people who have joined this webinar. Thank you very much. Wish you a great evening, and I'm sure that your organizations, you will do more program during the Patient Safety Week, and please participate in the WHO Global Challenge on medications without harm. Thank you all. Thank you.
Thank you, Balaji. Thank you for